Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's July 2022 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is an original article entitled Adherence to a Mediterranean Lifestyle and Changes in Frequency, Severity, and Localization of Pain in Older Adults. It is authored by Dr. Mario Delgado Velandia from the Universidad Autónoma de Madrid, IDIPAZ, in Madrid, Spain, and colleagues from other institutions in Spain and the Harvard School of Public Health in Boston, Massachusetts. The Mediterranean diet, with its constituents of fruits, vegetables, whole grains, olive oil, and seafood, among others, seems to possess an innate wholesomeness lacked by a calorie-enriched diet largely based on synthetic foodstuffs, saturated fat, simple sugars, and red meat. Indeed, there is considerable evidence that consumption of a Mediterranean diet is associated with a reduced risk for cardiovascular disease, type 2 diabetes, dementia, and other diseases. Remarkably, based on the current study by Delgado Velandia et al., the beneficial effects of a Mediterranean diet may also extend to the mitigation of pain. As pointed out by these investigators, overarching a Mediterranean diet is a Mediterranean lifestyle, which can be broadly subdivided into 3 components, in this study designated as blocks. Block 1 is the type of food consumption. Block 2 refers to eating habits, such as the intake of water, salt, and wine, snacks, and nibbling between meals. Block 3 is a component that relates to physical activity, rest, social habits, and conviviality. In their study, adherence to a Mediterranean lifestyle was quantitated by assigning, as appropriate, points to 27 items encompassed by 3 blocks, with non-adherence to an item scored as 0 and adherence scored as 1 point. The aggregate score constituted the MedLife Index. Delgado Velandia et al. Utilized data from the study on cardiovascular health, nutrition, and frailty in older adults in Spain, the Senior Enrica study in its 2 prospective cohorts. The earlier cohort with individuals aged 60 or older, and the later one with individuals 65 years or older. Assessment of pain was based on a questionnaire used in the Survey of Chronic Pain in Europe. Individuals in the highest category of MedLife adherence, compared with those in the lowest category, were more likely to experience reduced rather than exacerbation of overall pain after a median follow-up of 2.6 years. Such adherence was associated with reduced frequency of pain, its severity, and its number of locations. Additionally, when analyses were undertaken for each of the 3 blocks, individuals in the highest quartile of MedLife adherence compared with those in the lowest quartile, improvement with pain was observed for the Mediterranean food consumption block and for the block that comprised physical activity, rest, social habits, and conviviality. This important study by Delgado Velandia et al. Shows that adherence to a Mediterranean diet and lifestyle may mitigate pain syndromes, ones that, not infrequently, are physically incapacitating, emotionally distressing, and refractory to pharmacologic approaches. Moreover, the salutary effects of the Mediterranean lifestyle seem to go beyond those of the diet itself, with its additional attentiveness to regular physical activity and individual serenity, and its emphasis on its reaching out to and its connectedness with community. The first highlight this month is an original article entitled Incidence and Risk Factors for Acute Kidney Injury Following Chimeric Antigen Receptor T-cell CAR-T Therapy. It is authored by Dr. Naba Faruqi and colleagues from Mayo Clinic in Rochester, Minnesota. Among the salient complications of cancer and its treatment is kidney disease, the latter now entailing such specialized knowledge and occurring with such frequency and significance so as to engender a new subspecialty, onconephrology. The causes for cancer-related kidney disease are vast, as they may arise from either singly or in combination, the cancer itself or its treatment, attendant volume depletion or sepsis, or exposure to other nephrotoxic drugs or agents. Specific therapies directed against cancer, such as long-established chemotherapeutic agents, more recently developed targeted therapies, and novel immunotherapies are all recognized as causes of acute kidney injury. This study by Faruqi et al. Is the largest retrospective analysis to date of the occurrence of acute kidney injury in patients with non-Hodgkin lymphoma treated with CAR-T therapy. This study comprised 83 patients, 14 of whom developed acute kidney injury in the month after CAR-T therapy. 10 patients were diagnosed as having renal intrinsic acute kidney injury, 2 with pre-renal acute kidney injury, and 2 with obstructive acute kidney injury. Renal replacement therapy was required in 2 patients. By 1 month after CAR-T therapy, acute kidney injury resolved in 10 patients. In most patients with acute kidney injury, inflammatory capillary leak and/or a net fluid deficit were predisposing conditions. Tumor lysis syndrome occurred in a single patient. The incidence of acute kidney injury during the month of follow-up was associated with impaired renal function at baseline, exposure to intravenous contrast dye, prophylaxis for tumor lysis syndrome, and the dosages of corticosteroids and tocilizumab used in managing the cytokine release syndrome. Such prophylaxis for tumor lysis syndrome may reflect the clinical estimation of the tumor burden. And in this regard, higher peak uric acid and creatine kinase and the change in lactic dehydrogenase from baseline all correlated with the incidence of acute kidney injury. The administration of higher doses of corticosteroids and tocilizumab may reflect more severe cytokine release syndrome and accordingly more vigorous therapy in attempting to quell an accompanying inflammatory response. However, incident acute kidney injury did not significantly increase as the grading of cytokine release syndrome increased. The study by Faruqi et al. Thus delineates factors that incur the risk of acute kidney injury in patients with non-Hodgkin lymphoma treated with CAR-T therapy. The presence of such factors in patients treated with CAR-T therapy should underscore vigilance regarding renal function, adequacy of the extracellular fluid volume and renal perfusion, the avoidance of potential nephrotoxins, and the need for strategies that reduce the risks of tumor lysis syndrome and mitigate the severity of an inflammatory milieu. The second highlight this month is an original article entitled Efficacy of Prolonged Antibiotic Therapy for Renal Cyst Infections in Polycystic Kidney Disease. It is authored by Dr. Julien Dang and colleagues from the University of Paris, the Hospital of Paris in Paris, France. Urinary tract infection may occur in up to 50% of patients with autosomal dominant polycystic kidney disease, the most common inherited disease afflicting the kidney. Treatment of such infections may be especially challenging when the infectious process involves kidney cysts, as such cysts are frequently not in communication with the urinary space. Such sequestration of cysts, the lack of cyst irrigation by urine, and impaired diffusion of antibiotics into cysts may all predispose to failure of antibiotic treatment of infective cysts, as well as recurrent infection after a course of antibiotics is completed. Dang et al. Addressed these issues in a retrospective study of outcomes following antibiotic treatment of 139 cyst infections in 90 patients cared for over an 18-year time frame at their center. Cyst infection was defined as definite based on cyst puncture and culture, which is uncommonly done, probable based on clinical assessment and imaging procedures, and possible based on clinical and biochemical findings. Definite and probable cyst infections exhibited a relatively high rate of treatment failure and recurrence, 34% and 18% respectively, both of which were markedly lower in possible cyst infections, specifically 4% and 7% respectively. Treatment failure was associated with male sex, peak C-reactive protein level, and thickening of the cyst wall, but not with the type of antibiotics initially used or with cyst size. Recurrent infections progressively diminished with increased duration of antibiotic therapy. Antibiotic therapy that was equal to or greater than 28 days in duration was associated with quite low recurrence rates, specifically 2%. Recurrences were higher in kidney transplant recipients, and this likely reflected concomitant immunosuppression. Interestingly, lipid-soluble antibiotics, such as fluoroquinolones and Bactrim, are often recommended in treatment of infected cysts, because these antibiotics may be more likely to diffuse into cysts. However, Dang et al. Observed that such antibiotics were associated with less recurrences on univariate, but not on multivariate analyses. While the therapeutic benefit of lipid-soluble antibiotics for infected cysts merits further study, what is an abundantly clear and a critical message of this paper is the need for antibiotic therapy to be maintained for a minimum of 28 days. You can access these highlights and editor's choice articles free of charge during the entire month of July. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find links to our social media by clicking the buttons at the top of the home page and at the bottom of any page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you will find full-length author interviews called Insights, and our Mayo Clinic Proceedings 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and author insight podcast recordings, which are available from our website on the homepage as well as through iTunes. You will also find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content, as well as articles published online in press. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter
More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.